Okay, so this plea from Governor Little is based on what's happening within our hospitals and healthcare clinics. Running out of beds and space to put those beds, filled with more patients than staff to care for them. And it's not just in the major hospitals with intensive care units. Yesterday, Primary Health Medical Group set a record in terms of the number of patients seen. The number of patients coming in to get treated or tested for COVID is in the thousands daily. And they tell us their medical staff just can't keep up. So instead of increasing that staff, which isn't readily available, Primary Health is decreasing their hours to give their people a break. Here's Katya Stepovic.
Thanks for calling Primary Health Oberlin.
The phones are ringing off the hook.
Direct contact.
And luckily, today, most of them are being answered.
Do you have symptoms or no symptoms?
But that hasn't been the case lately, as Primary Health continues to set records on the number of patient visits daily.
Have you ever seen this clinic this busy before?
No, I have not. And I've been here almost 4 years at the Oberlin Clinic.
Doctors, nurses, and administrative staff don't mind the rare lull of patient influx Tuesday because lately there's been no such thing as a lunch break.
So normally all of our rooms are full. As I said, we're bringing patients in the back door that are respiratory and bringing them into the actual rooms to be seen by our providers.
Yep, right in here.
There's only so much you can do when you're frustrated with just the entire environment of having to see patient after patient after patient after patient and sicker and sicker and sicker and sicker. It is hard.
We are overwhelmed by the number of patients that need to be seen and need to be tested.
CEO of Primary Health Medical Group, Dr. David Peterman, says staff are having to turn patients away, something that's never been done before, not even at the peak of COVID cases last year.
We are getting to the point where we just physically can't see anymore.
What does it mean for the hospitals when you guys are at capacity and having to sometimes turn away patients? What does that mean for the hospitals? How can you help?
It's difficult for all of us. We're doing everything we can to see the patients here who are, mildly symptomatic. Obviously, we get some of the sicker patients, and unfortunately, we do have to send some of them to the hospital because there's things here that we're not able to provide that the hospitals provide. We just have to all work together. It's hard right now.
Monday, Primary Health saw a record number of urgent care patients, over 2,000 of them. 75% of patients were being seen for COVID. With longer wait times and overwhelmed phone systems, the urgent care facilities will now close an hour early to help medical staff catch up.
We've consistently just seen the numbers go up and up and up.
It's 12:30 and I'm looking at this bag of used protective wear, and that's pretty, that's substantial.
Yeah, well, and that's, we probably, yesterday, I think I swapped that bag out 3 times. Wow. So and then we have another one in the back too, and then of course we have the providers that are gowning up as well, and so there's several locations like that. It's busy.
With hospitals on the brink of divert and urgent care's overcapacity, medical experts once again plead with the community to step up.
We are at a crisis, and you can help us. And the way to help us is to wear masks to protect you and to protect others, particularly when you're indoors. And if you're eligible for vaccination, please get vaccinated. We are turning away people who are ill because we just can't see everyone. I am very sad to have to say to the public, to our patients, that we can't see everyone.
75 minutes, but right now it could take up to 2 hours. As for vaccination rates, they're administering about 120 first doses a day, which according to Peterman is a slight increase, but overall he says it's very disappointing.
And that wait time is just going to get longer with them decreasing their hours and such. And hopefully, as Governor Little announced today, some help is on the way with both National Guard, but also he said he's going to try to ease restrictions on nursing students coming out and getting back in or getting into the workforce right out of school. So we'll see if that has any play in this at all. Thank you, Katya.